Lisa, let me know when we're ready to get started, please.
You're ready.
Okay. Good afternoon, everyone, and welcome to our seminar series. We have two phenomenal women who's going to be sharing with us this afternoon. And I'm going to start with our guest. Ms. Joaquinia Colbert is the Fatherhood State Led, is with Fatherhood State Led. She's there with the Georgia Department of Public Health Maternal and Child Health section within the Division of Health Promotion, whose work is focused on the goal of intentionally engaging fathers in existing maternal and child health programs and services to serve as a subject matter resource and linkage to fathers, families, and practitioners. Ms. Colbert's work is accomplished using three core strategies: capacity building, collaboration, and coordination across traditional and non-traditional partners. She serves as lead as well as co-lead on multiple cross-sector projects that seek to create a culture of inclusion for fathers in research, policy, and practice across the state. Thanks for being with us, Ms. Colbert. We appreciate it. And now, one of our own, I'll do both introductions, Dr. Latrice Rollins. Dr. Rollins is assistant professor in the Department of Community Health and Preventive Medicine. She's also a Robert Wood Johnson Foundation Culture of Health leader, whose work is focused too on father engagement and father inclusive practices in maternal and child health, violence prevention, and other public health and social work areas. Dr. Rollins, before joining us here at Morehouse School of Medicine, worked for the Georgia's Office of Child Support Services and the Georgia Fatherhood Program. I don't know whether you guys knew one another at that time or not, Ms. Colbert.
We actually met during my time there at Morehouse.
Oh, really?
Yes,
oh,
yes,
okay.
yes.
Okay,
I'm
well,
a graduate of the program.
We reclaiming you. So
yes.
you both Morehouse. Okay, you're both Morehouse School of Medicine. Thanks. Dr. Rollins provides father engagement training for practitioners in various sectors. She is the editor of the book, Engaging and Working with African-American Fathers, Strategies and Lessons Learned. Congratulations, Dr. Rollins. We thank both of you, ladies, for working to advance health equity, specifically for African-American fathers and families. I'm going to let these ladies go forth with the lecture, but I think it's phenomenal, as they are women, that we often speak and will continue to speak about women's health and women maternal health and mortality, but it's enlightening and refreshing to hear about father inclusions, the inclusion of fathers in this area of health inequities. So thank you for being with us this afternoon. I don't know which of you will be speaking first, but the floor is open. Thank you.
All right. Well, good afternoon. I'm so honored to be able to share with you about this project and honored to be co-presenting with Joaquina, who is my partner in good. We started out, actually, like she said, she was a Morehouse School of Medicine MPH student, and didn't know that our paths would cross again once we got into this fatherhood work. And as you can see from the picture, we were at a fatherhood conference, ran into each other. That was 2019, and we have been rolling together ever since, working on different research projects, including the one that we're going to share about today. So our objectives this afternoon are really to talk about the benefits of father involvement in maternal and child health, also to talk about the Department of Public Health, Strong Fathers, Strong Families, Georgia Coalition, because this is a community-based participatory research project. So we did have a coalition to guide the work. We're also going to talk about that approach to this TX pilot project and the results from the project in our next steps. So as it relates to father involvement in maternal and child health, when you hear maternal and child health, you already are just mom and baby. But in order for there to be a baby, there has to be a dad, right? So what we're learning from research is that when dads are engaged, particularly in the prenatal stage, there are positive outcomes, not only for the baby, but also for the mom and the dad. And so in 2010, the Commission on Paternal Involvement in Pregnancy Outcomes, they strongly recommended that dads be included in prenatal care to reduce and eliminate racial and ethnic disparities in prenatal health outcomes across the United States. What that looks like in terms of, well, how does that matter? How does the father being involved, how does that lead to better health for mom and baby? What they found is that in terms of behavior, right? So moms, when dads are involved, moms are more than 2 times more likely to go to prenatal care in their first trimester. They're more likely to have better health habits in terms of diet. They're more likely to breastfeed and initiate breastfeeding. So all of these types of external supports for mom helps to help with those different behaviors, which lead to better health, which leads to reducing the risk for a lot of different things that may happen with mom. So with this evidence being there, we do know that the research is there. However, the practice, it actually getting into practice, that has been slow to implement. And so that's the work that Martina and I have taken on to make sure that maternal and child health services, they are including fathers, they're understanding the importance of doing that and finding ways to do so. Okay. So while we were, again, like I said, back in 2019, talking and dreaming and all of these different things that we wanted to do in the fatherhood realm, the opportunity for the TX pilot project grant came across and really wanted us to be able to look at a health disparity, a particular issue like that, and also to collaborate with a number of different partners. So we already had, myself, a community-based participatory researcher with that community engagement side, and then Martina with the health policy piece coming from the state. And with the Healthy Start programs and different things that she works with, we were able to engage our clinical or health services partners, which were the Columbus WIC department, and that's Women, Infant, and Children's Services, as well as the Clayton County Health District. They have a Healthy Start program for expecting and new moms and dads. And we also had a partnership with Centering Pregnancy at Grady Hospital. So that brought in our clinical piece, working with the hospital. We wanted to see across all of these various settings and with these partners, what is actually happening in the field as it relates to engaging fathers. Where are some of the gaps? What are some of the strengths in terms of their quote unquote father-friendliness? And we'll talk a little bit more about what father-friendliness means. But it's important for us to figure out before we jump into, okay, we need to do some intervention, we need to do some things to get that involved. You need to find out what's going on. You need to find out first what's actually happening across these different services. What are some of the strengths? What are some of the gaps? And how can we best meet the need? Also, we wanted to find out any existing programs and services that existed for fathers so that we can share that information, develop some type of referral and linkage database for these maternal and child health services, because again, they're very focused on the mom and the baby. So they don't know, a lot of them don't know what is available for fathers that may come into the office. And so we wanted to make sure that we put together some form of asset mapping and database for them to refer to. So that is kind of our ultimate long-term goal, is to be able to develop this referral and linkage system for maternal and child health providers so that when dads do come into those services, they know where to direct them, so that we can have better coordination of service, better integration and inclusion of fathers, and again, overall, better outcomes for the whole family. And I will turn it over to Martina to talk a little bit about the Strong Fathers, Strong Families Coalition. And you can let me know, Martina, when to advance.
Okay, thank you, Dr. Rollins. Can you hear me okay?
Yeah.
Excellent, excellent. So again, the Strong Father, Strong Families Georgia Coalition was extremely excited about this opportunity to be part of the TX pilot project. And as I tell you a little bit more about what our mission or our goals are as part of the coalition, you could definitely see why. So established as part of the Fatherhood Initiative at DPH and our work with the National Maternal and Child Health Bureau Workforce Development Center, the Strong Father, Strong Families Georgia Coalition was created and convened about the spring of 2019 as a strategy to improve the perinatal health outcomes in Georgia. More specifically, we were looking to develop and drive the state's collective impact approach towards meaningful father engagement across maternal and child health, and that's within the agency and with external partners. Our interdisciplinary team of father and family serving agencies includes state and local governments, academia, nonprofits and community-based organizations, fathers, and other non-traditional partners as well, such as fraternities and sororities. Our core advisory team or executive members serve as a representation of the general body and include maternal and child health programs that include Georgia Home Visiting, Healthy Start, Title V, the Georgia WIC program, Morehouse School of Medicine, PRC, and Timer Consulting Firm and the Center for Black Women's Wellness. So as part of our early efforts, and I do say early efforts because you'll see how the coalition's work has evolved even during the time of the TX project, our work was twofold essentially. Essentially, we wanted to create a coalition of family and father serving agencies and organizations that were committed to coordinating strategies, and then two, that would address linking initiatives to existing programs and services into an accessible father-friendly network. I want to say two quick things about accessible. We know that many programs and services are available to our families that we serve, but access is often a problem. And so we really wanted to be able to address access to these programs and services by really putting the resources into the community stakeholders and partners' hands that really are the boots on the ground with the families and the population that we're looking to serve. And we wanted to do that in a fashion, of course, where these programs and services are absolutely father-friendly. You'll hear that term referenced throughout the presentation, which is truly synonymous with a partnership that we have with the National Fatherhood Initiative, which is an organization that creates a number of evidence-based resources, tools, trainings, a number of opportunities for organizations to become more, have a greater built capacity on addressing and serving the needs of fathers. And again, we'll elaborate on the tool that they developed that we used in our research a little bit later as we get into the data. So essentially, we set out to do this work, create this accessible father-friendly network. And we knew and learned very early on that there were many existing efforts that served fathers that were already existing in our state, but they weren't necessarily coordinated or linked or even convening to maximize impact. So the coalition, as part of their work through the Workforce Development Center, saw this as an opportunity or our niche in the field. Dr. Rollins, advance the slide for me, please. So a little bit more about our structure and just to share a visual with you. The coalition functions as a collective through the work of its main committees here that are listed above. So our communications, evaluation, implementation, and sustainability committees. While the work of the TX project was primarily led by the implementation subcommittee, all of our committees were instrumental in setting the foundation for its success, beginning with the selection of the pilot sites that Dr. Rollins just outlined for you, which many of those are members or linked by our our reach as a state health department and her work at the PRC. So specific activities of our committees overall included our communications committee, identifying the evidence-based tools to be used in the project. So the National Fatherhood Initiative's Father Readiness Network Assessment, or Father-Friendly Checkup, which again, you'll hear more about as we reach the data, and the Father Research and Practice Network, or FRPN's Measure of Father Challenges. Another tool that is instrumental in identifying some of the challenges that fathers face in their social determinants. And so again, you'll hear more about our tools as we progress in the presentation, but those are two tools that were identified by our communications committee, as well as adapting the FRNA, or the Father-Friendly Checkup, for fathers. That Father-Friendly Checkup as it stands is a tool for agencies and organizations that do client-facing work, but there wasn't necessarily a tool that was readily available for us to get the father's perspective on how father-friendly these organizations were. So we took what was an evidence-based tool and we adapted it for the father's experience during receipt of service, whether it was with his partner at the participating agencies or his experience with mom and learning about those opportunities. We then piloted that survey across fathers from our coalition and within our communities for relevance, wordiness, literacy levels, making those necessary revisions before implementing it in our work. The evaluation committee, our evaluation committee was responsible for inputting the surveys into SurveyMonkey and disseminating those surveys to the 4 partner pilot sites. They were responsible for tracking the number of surveys completed or number of assessments completed and giving those regular updates. They were also responsible for the dissemination of our Partner Resource Guide survey, which was a survey that we shared amongst our coalition and community stakeholders to identify some programs and services that were available to fathers in order to build that repository that we spoke about very early on as being our long-term goal. Our implementation committee, as mentioned, they are definitely the leads on this work. And more critically, they provided the model for our sites to do this work and the technical assistance and support to project sites, especially once the pandemic hit. Our sites had to really pivot in areas of marketing and outreach to attract dads to either take the survey or participate in the study, which was altogether something very difficult. Our health departments weren't open to the public, so families were no longer coming in for services or coming in for benefits. And so many of our partner or pilot sites had to adapt how they provide services during this time. And so during that time, we had to get creative with sharing flyers, doing mass texts, doing webinars, or whatever we could do to announce the opportunity for fathers to participate in a greater way, because we know dads would have been bringing moms to receive those benefits, bringing moms to those appointments and those visits, but we didn't have because of COVID, we didn't have that person-to-person or face-to-face opportunity to really engage that dad. So the sites had to get more personable when attracting the attention of fathers and getting them to complete our surveys. And finally, our sustainability committee, you'll learn how they become more critical towards the end of our work, because as our tool indicates, father-friendly, we want to make sure that beyond our work with the TX, that our sites are moving towards the needle on becoming more father-friendly. We want to make certain that maternal and child health agencies are doing that work. And so we are inclined to continue these efforts with those sites beyond our work in TX. Dr. Rollins? So this is just an opportunity for you to see our logic model and just, again, how greatly aligned the work of the coalition was with the TX project. Since 2019, Dr. Rollins mentioned that's when we were attending our conference, but the coalition has maintained its commitment to the work that we set out to do and the TX pilot during this unprecedented time, serving as both a linkage and a resource to community stakeholders, fathers, and their families, accomplishing many of the activities Cs that you see on the logic model, the coalition has built the repository of programs and services, having those serve as the preliminary foundation for the TX Project Resource Guide and Access Map, which has later been expanded in the project, and you'll get a chance to see that as well. I do want to share with you what we learned from the early data of our resource guide, that about 79% of our agencies and organizations in our resource guide did provide direct services. So again, for fathers and males. So again, we learned that we were not new. This wasn't a new thing, that people were already doing this work. There were fatherhood support groups. There were daddy boot camps, job trainings, referral and placement employment agencies available, assistance with housing and transportation, just a number of opportunities, education to support breastfeeding and enhance infant safe sleep. We had health education and referrals, navigation and linkage services, but a number of services and products that were available to support fathers. In our activities, we hosted capacity building opportunities. For example, we had a speaker series with local and national subject matter experts from the National WIC Association, from the National Institute of Children's Health Quality, and Healthy Start. We had various trainings and educational workshops and webinars from our partners at the National Fatherhood Initiative, all of which served our partner pilot sites and the MCH agencies and organizations that we're educating about serving fathers in a more engaging and meaningful way. So more specifically to TX and our work with the coalition, we participated throughout the duration of this work, doing basically what we were established to do. And as was mentioned earlier, that is pretty much what we like to refer to as those 3 C's, and that's capacity building, coordination, and collaboration. Dr. Rollins, I turn it back over to you.
Great, thank you, Martina, for that. So as Martina mentioned, we have funded January 2020. So we were like, okay, we have these great plans. We're going to go into the agencies and do surveys with the fathers. We're going to do surveys with the staff, find out what's going on, and COVID. So that shut down a lot of things. And with this project being so focused on, father-friendliness and all of those types of things, COVID, with it came these visitation and companion policies that limited fathers from actually going to prenatal appointments or going to labor and delivery with their partners and things like that. So we thought it was important to actually talk with fathers as a part of this project. We can't talk about father friendliness and not even address COVID, and address this particular barrier that fathers were experiencing in terms of not being able to even be a part of these different appointments. So we did 2 focus groups, one with fathers in Metro Atlanta, as well as one with fathers in the Columbus area. Again, these are partners and other folks that are involved with the TX project. So that's why we chose those 2 locations. We had 15 dads to participate, and most of the dads had, most of them were new dads, meaning that their babies were under 1, so they were a couple months old. And then there were some dads that were expected, so just their partners were pregnant. We wanted to find out to what extent COVID-19 visitation policies were shared with them, or communicated with them. How did they feel about those policies? We wanted to know what services and supports they have received during the pandemic, and what services they needed. Also, what did they recommend in terms of making sure that healthcare providers that are engaged with. So across the groups, we found out that there were 4 main kind of ideas that came out of it. Fathers definitely wanted more specific communication given to them. A lot of information was, of course, passed to the mom and directed to the mother. And so they didn't, have a lot of direct communication to them. Also, they wanted more inclusive practices. So even though they weren't allowed to be a part of different appointments and things like that, there's technology, there's ways that they could have been, FaceTime, Skype, or something to allow them to be more included in the presentations or in the appointments. Also, just scheduling, different hours, making sure that they were available for different things. So definitely more father inclusive practices were recommended. Also standardizing those companion or visitation policies was a recommendation, because we had some fathers that were in the same community, but some father was able to go and one father wasn't able to go. Hear from, this one is able to go to the doctor appointment and this one is not able to go. They hear from the doctor, yes, you can go and be with your partner during, labor and delivery, and get to the hospital, no, you're not allowed. So there was a lot of like confusion and things like that. So they definitely recommended that there's just a standard policy across the board. And also they really shared very deeply about the impact on their relationship. So not only the relationship with the unborn child, because, going to those appointments, hearing their heartbeat and, seeing the birth, all of those things, that builds that rapport, that initial rapport with the child, but also there was impact on their relationship with their partner. And so one dad shared that, she understands why I'm not there, but it doesn't make it any easier. And so as my wife, I am her support system. So not being there, for their partner, even though they understood it's COVID, nobody has control over the things, but it did something, to the relationship, to the communication. So anyway, this is what we found out from the dads during this time when we couldn't go in and we were still trying to figure out how we were going to get these surveys accomplished. So eventually things did start to let up a bit, and we were able to strategize a way, as Joaquina said, to get with the staff as well as get with the fathers to do this father-friendly checkup to assess what was happening in our partner agencies. As she stated, we did a father-friendly checkup, which is a National Fatherhood Initiative tool. It assesses 4 domains, and I'll go over those as we go through the results. But it assesses 4 domains, 4 categories for each organization. Typically, it's administered just with the staff of the agency, but we really wanted to hear the father's perspective as well, just to match things up and see if staff said one thing and father said another thing. But our goal was to have at least 40 staff members take it to 10 at each of the 4 sites, and then have 25 dads at each of the sites to take the survey. We winded up with 41 staff to take the father-friendly checkup and 135 dads who completed both surveys. So in the area of leadership development really deals with the beliefs, the attitudes, the values that are held by the organization's employees. It deals with the culture of the organization and their impact on the delivery of services and programs. So we basically they're asked on a Likert scale from strongly disagree to strongly agree, whether or not they agree with certain statements about the organization in these different categories. And we looked at the items where they strongly agree or agree, and whichever ones had the kind of highest percentage, those are the ones that we categorize as strengths. The ones where they have a lower percentage of agreement, we categorize those as areas of improvement. Looking across the 4 partner sites in terms of strengths, they really do work to encourage the healthy development of a father-mother relationship, as well as encouraging the healthy development of a father-child relationship among their clients. They also shared that they agree that they experiment and remain flexible in creating, promoting, and delivering and evaluating client-directed efforts. In terms of areas of improvement, they thought that they could improve in terms of engaging non-staff stakeholders in their organization about the importance of serving fathers and about the importance of fathers to child well-being. They also thought that they could be better in terms of conducting regular assessments of particularly their policies and procedures as it relates to their level of father-friendliness. Also, making sure that there is adequate funding within the organizations to effectively serve fathers. When we did the survey with the dads in this same kind of area, they did definitely agree in terms of thinking that the staff do encourage a healthy relationship between the father and the mother, as well as with the father and the child. They also talked about, just basically that there wasn't a lot of, again, specific services for fathers in these organizations. They do feel welcome in terms of the space and things like that, but there aren't specific services for them. In the area of organizational development, which really we only administer this with the staff because the fathers really know, whether certain policies and procedures are in place. But we asked basically this category, there's 3 categories that fall under organizational development: policies and procedures, processes, and the physical environment. So in terms of strengths, the staff agree that, the space is gender neutral, so it doesn't feel like, again, they feel welcome. They welcome fathers and men who enter the organization's premises, and they also are open to constructive criticism regarding their personal biases. In terms of areas of improvement, again, these kind of specific things. So there isn't a special place for fathers in their offices. So there isn't an area where there are reading materials specifically for men. There isn't a kind of special time for fathers to interact with one another. Also, they thought that they could be better trained in terms of the best practices of father involvement that are used by organizations. And just to say something about this piece, this was good for a lot of the partners because for whatever reason, a lot of the partner sites, the health departments were moving. And so they talked about, we're in the process of moving, so we could create, some space for that. We could make sure that we have a changing station in the men's bathroom, just different things like that. So they appreciated, kind of hearing this type of feedback. In terms of program development, this area really deals with the services and programs that the organization offers, how it engages the staff in offering them, and how it promotes and markets them. So in terms of strengths, they did feel that the staff, they do hire staff that reflect and mirror the fathers in terms of culture and age, race and language. They do include fathers in services for, in terms of the general audience. So if there's a parenting program, we do make sure dads come. There just isn't a specific, father program that we include them within the organization. They invite fathers to participate in the full range of program or service activities. So if they're having different events and things, they do make sure that they invite them. In terms of areas of improvement, meeting the dads where they are. That is an area that a lot of them said, not where they think he should be, but meeting him where he is an area of improvement. Making sure that they have more male staff to deliver the programs and services, as well as periodically surveying the fathers to find out, what their needs and concerns were. So again, this was doing and being involved in this project was helpful for them because this kind of helped them check off that box. They're able to survey dads as well as find out what some of their needs were. The community engagement domain really deals with the ability of the organization to engage the community in the delivery of the services and programs. Really, what is the organization's reputation as it relates to fathers? Do fathers feel comfortable there? Are they a known resource in the community? In terms of strengths, they thought that they do have great marketing materials and messages that are, they reflect a commitment to serving fathers. They are direct and concise messages. They also encourage other organizations within their sector to work with fathers. In terms of areas of improvement, and again, we have to kind of take this with a grain of salt because this was during the pandemic. And a lot of these questions are dealing with outreach, and there was a lot of outreach going on at that time in the community. So areas of improvement included whether or not they were well known as being a leader in promoting responsible fatherhood, whether or not they conducted an assessment of their marketing to see if it, really applies and it really does ensure father-friendliness, and also sharing about any work and any successes that they have in terms of working with fathers. That's an area where they thought that they could grow. With the measure of fathers' challenges, as we talked about earlier, this was a tool that was developed by the Fatherhood Research Practice Network. It allows you to, as a individual, to say what are some of the problems you're dealing with, different challenges, and the severity of those problems. We asked the staff to say, what they kind of perceive of some of the issues that fathers were dealing with, and also ask the fathers to actually say, what are some of their challenges. This tool can help us in terms of streamlining and more narrowing the types of resources that we're looking for. Like we said, our second objective was to identify existing resources and services for fathers. once we find out some of these challenges and things like that fathers are experiencing, we can better kind of tailor some of those things that we're pulling out, some of those different programs and services that exist, so that we can make sure we are meeting those needs. So in terms of what folks said, the top kind of areas and challenges amongst the staff and the fathers: housing, not having a steady place to live, unemployment, again, understandable during this time, having car problems or a lack of transportation, and then not having enough money to buy things for the children. So once we kind of went through the results, we went through the results of the 2 assessments with each partner. And we asked them to think about 1 to 3 things that they wanted to change or wanted to do in each domain. The assessments are really nice. At least the father-friendly checkup, it basically tells you what should be done. So it was easy for them to just kind of say, well, we can work on this and we can work on that. So they were able to select 1 or 3 things that they really wanted to do in each of the domains. And Martina was great about talking them through some existing resources, either through National Fatherhood Initiative or other organizations, whether they're toolkits or free trainings, just a number of different things that can kind of help them in those various spaces. So getting to the second objective of this work, which is asset mapping, identifying those different services. We did an environmental scan, basically, to initially kick this off. We also, as Lakina mentioned, did a survey amongst the coalition partners, as well as with, our larger kind of initiative and community, to find out what are some of the services and programs that are offered to fathers in Georgia. We work with team, actually through Emory University and Georgia CTSA. They were great, helpful, and were able to take our data and make a map for us of where the different services were and things like that. And so we were able to at least put that together. Of course, this is static, but there is an interactive, version of this too, where you can kind of look and see, okay, the orange dot is child support, or blue dots are education, where's the actual, what's the actual name of that place, and who's the contact, and that type of thing. So we're working on this and continuing to figure out how exactly we want to share it. Is it through an app? Is it through a website? Or how is it that we want to make sure that folks get linked to these different services? And I'm going to turn it back over to Joaquina to talk about this father-friendly networking from.
I'm sorry, I was trying to get off of mute. So again, our vision for our father-friendly network is this linkage and referral network throughout the state that connects fathers and families to programs, services, and initiatives that embrace culturally relevant and evidence-based approaches in its policies, programs, and practices, and ensures that fathers are included, engaged, and represented in the family well-being model or strategy. This was an image that was developed at our community mobilization approach summit, which was called Fathers Matter, Mobilizing Fatherhood in Metro Atlanta. And between our vision as a coalition and over 180 maybe stakeholders from the community from more than 11 sectors, this is what we shared with them, and they began to do work with us to help us develop what some of this cross-sector collaboration and envisioning could look like. To date, our coalition has led many efforts to develop this father-friendly network. Our efforts are spanning our work through the health department, the state health department, and its stakeholders and community partners. It's through our work with Healthy Start. It is through our work with the Georgia Home Visiting Program, and just through many or numerous stakeholders that we were able to engage during this summit. And that together will comprise what we are developing and calling our father-friendly network, a host of vetted partnerships. And when I say vetted, the desire to continue using the tool, the father-friendly checkup, to really vet partners in their efforts to be father-friendly, to recognize areas of improvement that are needed, and to continue to be joined and collaborated in a common goal and with common characteristics across all of our agencies in serving the fathers and the families that they come from. We will continue acknowledging and increasing our knowledge of evidence-based practices and research and that enhance father-friendliness in policies and service delivery. Again, we're doing that at the state with our internal programs, as well as with our external partners. And all of these efforts together will increase a father's access to competent father and family serving programs across the state. Dr. Rollins?
So as a part of not only the TX pilot project requirements, but also just as a part of community-based participatory research, we wanted to make sure that we continue to share what we were learning, share what we're doing, again, to kind of get more translation into practice. And so we've been, successful in presenting at a number of different spaces. We've also had a number of different students through Morehouse School of Medicine, whether they were summer medical school interns or other interns, to work on this project with us and present during their different projects. We've also put together our results, and at least for the focus group, and plan to share those in the Strong Father, Strong Families Coalition Georgia newsletter. And we have submitted a manuscript that we're still awaiting their decision to the Maternal and Child Health Journal, just about our process in doing this work. So, and focusing specifically again on the focus group findings. So next steps and what we plan to do now. Some of these things we have already applied for, some of them we have already won. In order to continue to do these assessments, to continue to, as Lakina said, build this network so that when fathers are engaged in maternal child health services, there's resources for them so that they can be at their best. They can definitely help in making sure that they're contributing positively to their family, to the mother, as well as to the baby. So with the state applied for a HRSA grant called Emerging Issues in Maternal and Child Health that will be focused on fatherhood. And so we're still waiting to hear from that, but always optimistic about continuing this work. Also with some folks that we know, fellow TX pilot project investigator, Dr. Cheryl Franklin, as well as Dr. Natalie Hernandez and myself, we applied for a grant through NHLBI, and that was to, again, do some more father-friendliness assessments, as well as look at the receptiveness of doing some preconception health work with men as well as with women. And so we were awarded that grant in August. And so we're doing that work. And then with the Robert Wood Johnson, as was mentioned earlier, I am a cultural health leader in their program. And so we were funded to do a strategic initiative. And so with those funds, we're looking to create a toolkit to kind of help maternal and child health services do this same assessment. As we heard, we did quite a bit of tailoring to the tools and different things like that. Also, if you're familiar with baby-friendly designations for hospitals, we'd like to have a father-friendly designation. What does that look like? There are other cities that have done that with their social services. I believe the city of Long Beach has a father-friendly designation for different agencies that serve dads. We want to do the same thing here in Georgia. And so we're using some of the funds from the strategic initiative to develop the toolkit, also to develop what are these guidelines and practices for being a father-friendly agency. All right, and so at this time, I just turn it over to anyone if you all have questions or comments Anything that you all want to share or hear from us?
Well, this has been absolutely fantastic, just so informative and a breath of fresh air to hear all that's being done in the fatherhood space, if you will. And at this time, we open up the floor for questions. At least I don't know whether you can see full screen or not, but maybe we can open to full screen so we can be sure and see what hands are being raised for questions. Questions, comments? Yes, Dr.
Question.
Tom.
Yeah, I did not hear about your control group to determine whether your intervention is effective in with your fathers. That's one. And two, when you, so what have you find thus far as it relates to differences with Blacks, non-Hispanic whites, Hispanic, Latino, and I guess that's pertain to the first question in terms of knowing if what your final outcome to make any type of recommendation for fatherhood engage with mothers.
So this was a pilot study was kind of do an assessment of what was actually happening, not necessarily to test. So we didn't have like a control group and an intervention. We weren't delivering an intervention. We were only doing an assessment to find out what services, what the environment was for in these different maternal and child health services for fathers. So we didn't test to see if the fatherhood programs that they have, or if the doctors that were there, we didn't look at any outcomes in that respect. We were mainly just looking to see how do fathers feel in those spaces, what are their perceptions of the services that are provided in those spaces from their perspective, and then also from the staff perspective. Again, before we even wanted to jump to any type of intervention, we wanted to see what was going on already. Because I feel like that's kind of the issue that happens. We jump the gun with trying to put a program together and different things without understanding the context of a lot of these organizations and agencies, particularly in this space of fatherhood in maternal and child health. There's I'm trying to say it a certain way. There has been a certain level of resistance. It's like, why do we have to do that? Why do we have to engage the dad and things like that? So we can't even get to intervention if you don't understand the importance of engaging dads, or even if you're not doing it at all. So this was just kind of a pilot to kind of understand the landscape of what is happening in these particular partner agencies.
But even if you're making an assessment, then you have to have, I hope that you're looking at various groups, maybe single dads engage with, or unmarried rather, with married, making an assessment between different culture, even within African-American community, those that may be from other countries, other region of this United States, in terms of getting a full assessment of the relationship between mothers and fathers. And it could be cultural, some aspects could be cultural that may influence how this engagement occurs. And so I hope that you also consider that in your assessment when you're making an assessment of this relationship.
Absolutely look across the different settings. All of the participants are African American. So that was, our main thing was to be able to address Black maternal mortality and morbidity. And so these were African American fathers that were surveyed. And so we can definitely look across the sites to see if there are differences, whether there's difference in engagement in clinical space versus community-based organizations or something along those lines. But
So what you're saying, you excluded individuals from other countries that maybe from Africa that are Black or from the Caribbean. So you only focus on African American that are born in this country.
we actually put out Black/African American. So however they identify.
Ms. Colbert, did you have a?
No, I was going to speak to that, just that in our demographics, that was how we collected the data. It was how they self-identified. We didn't exclude for a particular Black or brown culture. We didn't do that.
Okay, thank you. Ashton?
Hi, so I came just a little late. I do apologize if you kind of talked about this, but from just hearing what has been mentioned, it's kind of, so you guys are doing these surveys and interventions during when a woman has already been pregnant, right? You're not doing anything before, like with couples who are planning on getting pregnant, because I'd be really curious to see, you know, you may have some fathers and mothers who maybe the father causes more stress for the mother, maybe they're not in a good relationship, etc. And I do find as a man, we're just not generally educated on women's health in general. And I wish that would change because I think it's very important. But, you know, I'm just curious to see how you guys can help men understand the knowledge, or maybe get them more interested in the knowledge in general of just the birthing process. Because I, you know, unfortunately, I wish it was different, but it seems to me most guys I have met, they just don't care enough. And I think it's a big thing to consider, obviously, but I'm just kind of curious.
I think there's an opportunity, Ashton, to definitely gear our efforts following this study towards education for dads. But what we wanted to do in this particular study was understand how agencies and organizations that operate in those maternal and child health settings, how they see themselves and how fathers see them during the time of a visit with mom or reception of services with mom. I agree in that we could definitely do a better job at educating dads about the pre and perinatal and postnatal periods, so that he can be of greater support to moms. And that is our effort. But I think in an effort to get to that place, we have to understand the systems that are in place that are providing that information. And that is what this work was targeted to do, to really understand how do we address a systems approach or adapt a systems approach to helping to educate dads and get them more involved and get them more engaged. And how do we address even our own biases and the historic position of our maternal and child health, right? Because that in and of itself says that it's all about mom and baby as opposed to paternal and maternal and child health. And that is likely some of those things that will not change, but we have to figure out how do we call out dads in our work specifically so they find a place within our programs and services that will absolutely serve them. So I think this work is kind of like that ground level work that is going to help us to look at the systems and the willingness of those systems to transition to a more comprehensive approach when serving families, to be more inclusive of dad, so that dad's awareness of his impact on family can be more elevated, right, in public messaging and in the services and the resources and tools that we provide for families. Dr. Rollins?
Yeah, I was just going to add that, you know, some of these, they weren't all expected fathers. So some of them already had children, like with the WIC program, they already had, you know, young children. And with the Healthy Start program, they serve parents who have children from, you know, either they're expecting all the way up to 18 months. So there's a varying kind of age in terms of the parents that are engaged in these different services considered, you know, maternal and child health.
Okay, thank you guys so much.
Thank you.
Thank you. Thank you, Ashley, for your question. There's a question in the chat box from Jerome that reads, are there any actions being taken to improve or fix child support?
So we're excited because we have, first I want to recognize Jerome, and we're excited to have him. He is the new fatherhood coordinator at our Columbus Healthy Start site, and he is working within the health department. So he'll become a part of that culture that we're trying to address and improve. And so I'm excited to have him on the call today, or on the webinar today. As one of our partners of the coalition, we have the Fatherhood Division of Child Support Services Fatherhood Program. And one of the things that they are really trying to do in their efforts is change their stigma with fathers and families, as was, you know, as we interpret it, right, that they're enforcement. But they actually do have a number of programs, Jerome, to support dads. So they support dads with the intent, of course, to get them to meet their financial obligations with the child, but they support dads in GED and high school diploma programs, with job readiness, and a number of other programs that they have. And the Division of Child Support Services Fatherhood Program is statewide. So they do have an office in each of the counties in Georgia. So that is something that they're trying to raise awareness on. And we do continue to partner with them and share space with them so that people can learn more about what they are providing. Where it comes to child support, and I'm only imagining that when you say fixed child support is maybe that equation that is used, right, that determines how much dads pay in child support. I think my knowledge doesn't include any the effort or strategy being taken to address that, more than some of the supports that are being put in place to support getting to the numbers that work for the child.
Okay, I should have probably been a little more specific. I was looking, I guess, more towards some of the, I guess you could say, one of Georgia's laws that specifically takes away the driver's license if you are in rears or if you don't. I just find that, I don't know, I think it's counterproductive, because most are going to need a vehicle to get to work.
Absolutely.
And you can't even get a limited access driver's license, which you can go down the road and get a super speeder ticket and be eligible for a limited use driver's license. But child support, it flat out denies it, and you can't get anything. So I just find it counterproductive that you're gonna make, as a man, you're gonna make that situation worse, because not only can I not go to work, but then I can't pay the child support I need to pay, but I can't get my driver's license because of, so I was just wondering if there was, if any agency had kind of picked up on that over the years, and if anyone was trying to get a coalition together to petition the state to fix it or modify it or something like that.
For sure.
At the end of the day, what you say, Jerome, it's punitive to the child, actually.
Right. Right, it is. And I completely understand that. And I want to share one thing, and then I want to ask Dr. Rollins to share from our Fathers Matter work that is currently happening with those stakeholders. But I want to share that through the fatherhood program that Division of Child Support offers, that they do have, if you participate in their father program, then you receive support on those arrears, and you receive support in not having your driver's license suspended or getting that driver's license reinstated, but you have to, that it's contingent upon you participating in the fatherhood program. And when I think about some of our court systems have been linked through our partners to saying that we'll release this father into the custody of this fatherhood program. And when he can show completion of this program, then we'll work with him on reestablishing himself so that he can, have the driver's license or be allowed to return to work and not be incarcerated and those things. Because you're absolutely right. It is counterproductive. And I definitely think it's been organized. But at a policy level, I think some of our Fathers Matter work is looking to address that. And Dr. Rollins, did you have anything you wanted to share further?
Yep, and so that's why it's, so important, again, to make sure that we have all of these different programs and resources in place when we talk about engaging fathers, because here comes a number of different challenges and barriers that are systemic, that are historic, that we have to address in order to make sure that we are supporting their involvement and not hindering it.
Mm.
So if you remember earlier when Martina was sharing about the Father-Friendly Linkage Network, she shared about the Fathers Matter mobilizing fatherhood in Metro Atlanta, that summit that we had back in March, putting together a group of stakeholders to think about different strategies that need to be put in place to promote and support father involvement. One of those strategies that the coalition or that initiative came up with is to implement father-friendly policies. And so one of the things that they are looking at is legitimation. That's a big issue here in Georgia, only state that deals with this, but that's one of the issues. Improving relationships with agencies, that's another strategy, a big area in terms of agency, not only Department of Family and Children's Services, but child support services as well. So how can we make sure that those relationships are improved? How can we make sure that those policies are improved so that we can make sure that dads can be involved as fully, as they need to be and want to be?
Dr. Alex, Dr. Alexander.
Hi, thanks, Dr. Harisuka. And I think first of all, I would like to acknowledge the excellent work and presentation by our presenters. This is really an excellent mixed methods pilot study. Part of my question has been answered, but the second part of it is based on the logic model that you presented. What are the next steps?
That's a good question. So where we are now with having launched the Fathers Matter conference or summit back in March is really expanding the coalition to include more partners across different sectors. And with that work, what we'd like to do is be able to do several things. One thing is to be able to continue to explore what is the platform that we will use to share these resources that we've amassed for fathers, so that agencies, organizations have tools and resources that they can share with the fathers that they serve, as well as we have community awareness of what these existing programs and services are and how fathers are to be able to access those. We want, again, to take that resource guide to the next level and being able to establish a linkage and referral system. What does it look like when a dad is referred from Division of Child Support Services to mental health services? What is the intake process for that father, so that we can know when a dad leaves one organization and is in need of another resource at another organization, that he will be well received, and that our dads will not be turned away with frustration of being able to access services or really being able to get the treatment that they need. So we really need to continue to work with the stakeholders that have been brought together for the purpose of that resource guide and access map, continually flushing out what it is that they offer. How do our dads truly access it? What is the steps to accessing services and so forth? So that will be one of the things that we do. In addition, we'll continue to vet these organizations. So again, we want to make sure that when we turn a dad to a particular agency or organization, that he is in good hands and that he'll be served appropriately. By expanding these partnerships through our Fathers Matter work and the various strategies that they are working on, which is 7 strategies throughout policy, throughout program and service delivery, and just creating a greater awareness. We want to be able to establish that network that we're speaking about that serves the fathers. We want to be able to replicate even the work that we've done with these 4 sites, with other sites throughout our health system. So again, taking this model of assessing father friendliness and action planning with those sites, we would like like to do that with all of our health departments and greater understand where they are in their practice and in their policies for being able to serve fathers as they support moms throughout these pre, post, and perinatal stages. I could probably go on and on, to be honest, Dr. Alexander, because we have so many hopes for the work that we want to do with fathers. Dr. Rollins alluded to the toolkit, but we definitely want to have that father-friendly designation for state partners. We really want to have bubble to the top this work that we're doing and the importance of this work and how it will really impact the outcomes that we have in our state. So we're looking to do that designation. We're looking to, you know, have press releases and have those things become very public with across our state of what we're doing to support dads. We've had proclamations for the metro counties in Atlanta acknowledging June as Fatherhood Celebration Month. So we're doing various strategies or putting in place various strategies to keep the work moving ahead. Dr. Rollins, I know that was a lot.
You did.
All right. Okay, thank you. The rationale for asking that question is that I'm trying to tie it back to the question that Dr. Thompson asked earlier on, that because this is a pilot study, or this was a pilot study, even before you get to the point of interventions, wouldn't you scale it up a little bit to validate that before you start thinking about interventions?
So again, you're just trying to, you will have to look again at the data to see, like Dr. Thompson was talking about those differences and kind of what are some of the key takeaways besides what was specific to those particular agencies. And as Joaquina shared, you know, continuing to do the assessment with other organizations and agencies that, you know, we've already been funded to do that with some other clinical sites as well as some community sites to figure out what is their, you know, father-friendliness and what are they doing to really engage dads in their services.
Thank you.
Thank you both. Any other questions or comments for our speakers this afternoon? Okay, we're being asked to please fill out the survey. You can open it on the web by clicking the link. And it helps us in knowing what you want to hear and who else you might want to hear from on the research front. Other questions and comments? If not, we'd like to thank both of our Morehouse School of Medicine partners here, Ms. Colbert and Dr. Rollins. Thank you so much for a very informative lecture this afternoon.
Thank you for the opportunity.
All righty. Everyone have a great weekend.
You as well.
Thanks for joining
Thank
us.
you.